Have you ever experienced a dull ache or sharp pain in your testicles and brushed it off, thinking it's nothing serious? You're not alone. Every day, countless men around the world silently endure testicular discomfort, unaware of what their body might be signaling. What many consider a minor issue can sometimes be a warning bell for something much more serious. But when should you worry? And what should you do? Testicular pain is one of those symptoms that men are often too embarrassed to talk about. Whether it's a sudden shooting pain or a lingering dull ache, this discomfort can be alarming, confusing, and sometimes even terrifying. Yet, it's still misunderstood, underestimated, or ignored altogether. In truth, pain in this sensitive area should never be taken lightly. The male reproductive system is a complex and finely tuned part of the body. When something goes wrong, it often sends signals, and pain is one of them. The pain might come from within the testicle, or it might radiate from surrounding structures like the epididymis or spermatic cord. It could be from an infection, inflammation, trauma, or even something more dangerous like torsion or cancer. But how do you know which is which? Imagine waking up in the middle of the night with intense testicular pain. You're sweating, your heart is racing, and you don't know what's happening. Could it be torsion, a condition that can permanently damage the testicle within hours? Or is it something less urgent, like an infection that antibiotics can fix? The difference is life-altering. That's why knowledge isn't just power, it's protection. In this voiceover, we're diving deep into everything you need to know about testicular pain. We'll explore its most common and uncommon causes, from minor injuries and infections to serious emergencies. You'll learn about symptoms you should never ignore, what they mean, and how to recognize the red flags. We'll walk through the types of treatments available, from simple home care to urgent surgical interventions. This isn't just a medical lecture. It's a wake-up call for anyone who has ever dismissed discomfort down there or hesitated to ask for help. Because when it comes to testicular pain, early awareness can prevent complications, preserve fertility, and even save a life. So whether you're someone currently dealing with pain, a concerned partner, or just someone who wants to be informed, stay tuned. We're breaking the silence around testicular health and giving you the full picture, one essential detail at a time. Because your health isn't just important, it's everything. Let's get started. The often ignored alarm, testic pain. It's a phrase that can make any man feel uneasy, a sensation that ranges from a subtle ache to a piercing jolt. It is often shrugged off, ignored, or masked with over-the-counter painkillers. Yet what many fail to realize is that pain in this sensitive area is never random. It's the body's way of saying something isn't right. In this in-depth guide, we explore everything you need to know about testicular pain, its causes, symptoms, possible complications, and treatment options. Testicular pain can be alarming. The testicles are sensitive, and any discomfort is usually taken seriously, though sometimes not seriously enough. While minor discomfort might result from something as harmless as overexertion, more severe pain can be a sign of underlying health issues that require immediate medical attention. Knowing the difference could save your fertility or your life. Section 1. Understanding testicular anatomy. To understand testicular pain, it's essential to have a basic understanding of testicular anatomy. The testicles, or testes, are two oval-shaped organs housed in the scrotum, responsible for producing sperm and testosterone. Each testicle is connected to the body via a spermatic cord, which contains blood vessels, nerves, lymphatics, and the vas deferens, a tube that carries sperm to the urethra. The testicles are surrounded by a series of layers, including the tunica vaginalis and tunica albuginea. These layers help protect the organs, but also serve as potential spaces for fluid or blood accumulation in case of trauma or disease. The epididymis, a coiled tube on the back of each testicle, stores and matures sperm. Pain in the testicles can originate from any of these components or radiate from nearby structures. Section 2. Common causes of testicular pain. 1. Trauma or injury. One of the most common causes of testicular pain is physical trauma. A direct blow to the groin area during sports, an accidental bump, or even tight clothing can cause bruising, swelling, and significant discomfort. While most injuries are minor and resolve with rest, some trauma can result in testicular rupture, requiring emergency surgery. 2. Epididymitis. Epididymitis is inflammation of the epididymis and is most often caused by a bacterial infection. In sexually active men under the age of 35, it's frequently linked to sexually transmitted infections, STIs, such as chlamydia or gonorrhea. In older men or boys, it may result from urinary tract infections or bladder reflux. Symptoms include a gradual onset of pain, swelling, redness, and sometimes fever or chills. 3. Orchitis. Orchitis is inflammation of the testicle, usually resulting from viral infections like mumps. It often occurs in males who have not been vaccinated against the mumps virus. Orchitis can cause sudden testicular pain, swelling, and tenderness. In some cases, it may follow epididymitis, leading to a condition known as epididymo-orchitis. 4. Testicular torsion. Testicular torsion is a medical emergency. It occurs when the spermatic cord twists, cutting off blood supply to the testicle. This condition requires immediate surgical intervention to save the affected testicle. Symptoms typically involve sudden, severe pain in one testicle, swelling, nausea, vomiting, and a high-riding testicle. Number 5. Inguinal hernia. An inguinal hernia happens when a portion of the intestine pushes through the abdominal wall into the inguinal canal, sometimes reaching the scrotum. This can lead to pain, swelling, and a noticeable bulge. The pain may worsen when lifting, coughing, or straining. 6. Varicocele. A varicocele is an enlargement of the veins within the scrotum, similar to varicose veins in the legs. It often develops over time and can cause a dull, aching pain, especially after standing for long periods. It may also affect fertility due to increased scrotal temperature. 7. Hydrocele. A hydrocele is a fluid-filled sac surrounding the testicle, leading to swelling and mild discomfort. It's usually painless but can cause a feeling of heaviness or pressure in the scrotum. Hydroceles are more common in newborns but can also occur in adults due to inflammation or injury. 8. Spermatocele. A spermatocele is a benign cyst that forms in the epididymis and contains sperm. It's usually small and painless but may become large enough to cause discomfort or pressure in the testicle. 9. Kidney stones. Though not directly related to the testicles, kidney stones can cause referred pain that radiates to the groin and testicular area. The pain is usually sharp, severe, and comes in waves. Other symptoms may include blood in the urine, nausea, or painful urination. 10. Testicular cancer. One of the more serious but less common causes of testicular pain is cancer. Most cases of testicular cancer are painless, but some men may experience a dull ache, heaviness, or swelling in the testicle. Early detection through self-examination and medical imaging is key to successful treatment. Section 3. Symptoms that should never be ignored. Pain is not the only indicator that something is wrong. Other symptoms accompanying testicular pain may help identify the underlying cause. Sudden or severe onset of pain, swelling, redness, or tenderness, a lump or mass in the testicle, high-riding testicle, fever and chills, nausea or vomiting, pain during urination or ejaculation, blood in urine or semen, discharge from the penis, abdominal or groin pain. Any combination of these symptoms warrants immediate medical evaluation. Delay in diagnosis and treatment can result in loss of fertility, permanent damage, or even loss of the testicle. Section 4. Diagnosis. What to expect at the doctor's office. When testicular pain becomes a concern, a healthcare provider will begin with a detailed medical history and physical examination. Key questions may include: when did the pain start? Is it constant or intermittent? Is it associated with any trauma, fever, or urinary symptoms? Are there any lumps, swelling, or changes in size? A physical examination will include inspecting and palpating the scrotum, groin, and abdomen. Additional diagnostic tests may include: 1. Urinalysis, to detect signs of infection or blood. 2. Urine culture or STI screening, especially in cases suspected to involve bacterial or sexually transmitted infections. 3. Scrotal ultrasound, a key imaging tool used to evaluate blood flow, detect torsion, identify masses, or diagnose conditions like varicoceles, hydroceles, and tumors. 4. Blood tests, to assess for systemic infection or markers of cancer. 5. CT scan or MRI, in complex cases or if referred pain is suspected, Prompt diagnosis is critical, especially in emergencies like testicular torsion, where time can mean the difference between recovery and loss. Section 5. Treatments for testicular pain. Treatment for testicular pain depends on its cause and severity. Here are some of the most common treatment strategies. 1. Rest and home care. Minor injuries or strain-related pain can often be managed at home with rest, ice packs, scrotal support, like snug-fitting underwear, and over-the-counter pain relievers such as ibuprofen or acetaminophen. 2. Antibiotics. Bacterial infections like epididymitis or orchitis are treated with antibiotics, usually prescribed after lab testing confirms the organism. Infections related to STIs may also require treatment of sexual partners. 3. Surgical intervention. Testicular torsion requires emergency surgery to untwist the spermatic cord and restore blood flow. If treatment is delayed more than 6 hours, the risk of permanent damage increases. Surgery may also be required for hernias, hydrocele, or testicular tumors. 4. Aspiration and sclerotherapy. In the case of large hydrocele or spermatoceles causing discomfort, aspiration, removing fluid with a needle, followed by sclerotherapy, injecting a substance to prevent reaccumulation, may be used, though recurrence is possible. 5. Cancer treatment. Testicular cancer treatment typically involves surgical removal of the affected testicle, orchiectomy. Depending on the stage and type of cancer, chemotherapy or radiation may also be required. 6. Chronic pain management. For persistent or unexplained testicular pain, a multidisciplinary approach may include pain specialists, urologists, nerve blocks, or even surgical nerve removal, denervation of the spermatic cord. Section 6. Complications of untreated testicular pain. When testicular pain is ignored or left untreated, the consequences can be severe. Many causes of testicular pain, such as infections or minor trauma, may resolve on their own or with minimal treatment. However, serious conditions like testicular torsion, untreated epididymitis, or malignancy can result in life-altering outcomes. Number 1. Infertility. Chronic infections or structural damage from trauma can affect sperm production and transport. Epididymitis, when prolonged or recurrent, may cause scarring of the epididymis, leading to blockage and reduced fertility. Torsion, if not treated promptly, can lead to testicular atrophy and infertility. 2. Testicular loss. In the case of torsion, if the spermatic cord remains twisted for more than 6 to 8 hours, blood flow is restricted and tissue death begins. This often leads to surgical removal of the affected testicle, orchiectomy. 3. Chronic pain syndrome. Some individuals develop chronic scrotal pain even after the initial condition is resolved. This may require long-term pain management or nerve-related interventions. 4. Abscess formation. Severe infections that are not managed in time can lead to abscesses, pockets of pus, that may need to be drained surgically. 5. Systemic infections. Untreated infections may spread beyond the scrotal area and result in sepsis, a potentially life-threatening condition where the body has an extreme reaction to infection. 6. Cancer progression. Testicular cancer is one of the most treatable forms of cancer, especially when detected early. However, ignoring symptoms may lead to cancer spreading to lymph nodes or other organs, complicating treatment and reducing survival rates. Section 7. Prevention of testicular pain. Prevention strategies vary based on the root causes of pain, but generally include good hygiene, injury prevention, regular self-examinations, and timely medical consultations. 1. Practice safe sex. Using protection and getting regularly tested for STIs helps prevent infections like chlamydia and gonorrhea, which are leading causes of epididymitis. 2. Wear protective gear. For athletes or those participating in contact sports, wearing an athletic cup or proper groin protection can help prevent trauma. 3. Avoid heavy lifting without support. Straining without proper technique or support can increase the risk of hernias, which may lead to referred pain in the testicular region. 4. Good hygiene practices. Regular bathing, wearing clean underwear, and avoiding prolonged damp conditions, like wet swimsuits, can prevent infections and irritation. 5. Monitor symptoms early. Early consultation with a doctor for any pain, swelling, or abnormal changes can prevent progression of disease and reduce the risk of complications. 6. Vaccination. Vaccination against mumps can reduce the risk of viral orchitis, particularly in adolescent boys. Section 8. Testicular self-examination, TSE. Monthly testicular self-exams can help detect lumps, swelling, or abnormalities early, often before pain arises. Steps for TSE. 1. Timing. Perform the exam after a warm shower or bath when the scrotum is relaxed. 2. Use both hands. Hold each testicle gently between your thumb and fingers and roll it slowly. 3. Feel for lumps. Look for any hard lumps, changes in size, shape, or consistency. 4. Identify normal structures. The epididymis lies behind the testicle and may feel like a soft, coiled tube. It's normal and shouldn't be mistaken for a lump. If any irregularities are detected, such as a hard lump, sudden swelling, or significant pain, a medical professional should be consulted immediately. Section 9. When to see a doctor. While some mild discomfort may resolve on its own, there are clear signs that require immediate medical attention. Sudden, severe testicular pain, swelling or tenderness with fever, a lump that feels hard or doesn't go away, pain accompanied by nausea or vomiting, redness or warmth in the scrotum, high-riding testicle, pain that persists more than a few days. These symptoms may indicate conditions like torsion, infection, hernia, or cancer, each of which can worsen significantly without timely care. Section 10. Emotional and psychological impact. Pain in the testicles doesn't just affect the body. It can also take a toll on mental and emotional well-being. The embarrassment surrounding male reproductive issues often leads to hesitation in seeking help. This delay can cause unnecessary suffering, worsen conditions, and increase anxiety. Men experiencing ongoing pain may deal with fear of infertility, anxiety about cancer, embarrassment in relationships, decreased sexual confidence, depression or chronic stress. Open communication with a doctor, partner, or counselor is essential for mental health, and acknowledging emotional struggles is an important part of healing. Section 11. Myths and misconceptions. Misunderstandings about testicular health are common. Let's address and debunk some of the most widespread myths. Myth 1. Testicular pain is always caused by trauma. While trauma is common, many cases are due to infection, inflammation, torsion, or even cancer. Myth 2. Only older men get testicular problems. Testicular torsion and cancer most often occur in young men aged 15 to 35. Myth 3. All lumps are cancerous. Most lumps are benign, such as cysts or fluid collections, but every lump should still be evaluated by a doctor. Myth 4. You can walk off testicular pain. Ignoring pain can lead to delayed treatment and serious complications. Myth 5. If you don't feel pain, everything is fine. Testicular cancer often presents without pain, making self-exams and routine checks vital. Section 12. Role of urologists and specialists. A urologist is a medical doctor who specializes in the urinary tract and male reproductive system. If your general doctor suspects a serious cause for testicular pain, a referral to a urologist may be necessary. Urologists may provide specialized imaging or diagnostic testing, surgical treatment if required, fertility preservation counseling, management of chronic pain syndromes, cancer treatment planning. In cases involving infertility, collaboration with fertility specialists or andrologists may also be involved. Section 13. Lifestyle and long-term management. For those who experience recurrent testicular pain or have a history of past injury or surgery, lifestyle management becomes important. 1. Regular exercise. Maintain a healthy weight and avoid long periods of sitting, which can cause discomfort or worsen conditions like varicoceles. 2. Scrotal support. Wearing snug, supportive underwear can reduce pain during physical activity or recovery. 3. Monitor hydration. Adequate water intake helps prevent kidney stones, which can cause referred pain to the testicles. 4. Avoid high-temperature exposure. Frequent use of hot tubs or prolonged heat exposure can affect sperm health and cause discomfort in some men. 5. Stress management. Chronic stress may worsen the perception of pain. Practices like meditation, therapy, and exercise can be helpful. Section 14. Special considerations by age group. In infants and children, testicular torsion is possible even in newborns. Any sign of a swollen or discolored scrotum should be evaluated urgently. In older children, trauma or torsion are primary concerns. In adolescents, torsion peaks during puberty. Early education about testicular health can help young boys speak up if symptoms arise. In adults, Infections, hernias, and varicoceles become more common. Cancer risk also begins in early adulthood, making self-exams important. In older men, prostate issues and chronic testicular discomfort may arise. Risk of hernias increases, and STIs can still occur. Pain in older men should never be ignored or dismissed as just aging. Section 15. Summary and takeaway. Testicular pain is a symptom that can signal anything from minor injury to life-threatening conditions. Its causes are varied, and the consequences of delay can be severe. But with knowledge, awareness, and timely action, most cases can be effectively managed and treated. Key points. Never ignore sudden or severe testicular pain. Perform monthly testicular self-exams. Seek prompt medical evaluation for lumps or changes. Understand the wide range of potential causes. Practice preventive care, including STI protection and injury avoidance. Don't let embarrassment prevent you from seeking help. Remember, early detection saves lives. Taking your testicular health seriously is not just about avoiding pain. It's about preserving your overall well-being, your fertility, and your future. If you or someone you know is dealing with testicular pain, speak to a healthcare provider without delay. Section 16. Testicular pain in athletes. Athletes, especially those involved in contact sports, are at higher risk of testicular injuries and pain. Sports like football, martial arts, hockey, cycling, and horseback riding can put pressure or cause direct trauma to the groin area. Common issues in athletes. 1. Blunt trauma. A hit to the groin during sports can cause sudden, intense pain, bruising, and swelling. Most cases are minor, but some may cause rupture or hematoma that needs surgical attention. 2. Repeated microtrauma. Sports like cycling or rowing can cause repetitive strain on the perineum and groin area, potentially leading to chronic testicular pain or referred pain from pudendal nerve irritation. 3. Hernias from straining. Weightlifting without proper technique can result in inguinal hernias that push into the scrotum and cause pain. Prevention tips for athletes. Always wear proper protective gear like athletic cups. Warm up and stretch before strenuous activity. Avoid overtraining or ignoring early symptoms. Use proper lifting techniques and posture. Stay hydrated and maintain good core strength. Section 17. Testicular pain and sexual health. Sexual activity and reproductive health are closely tied to the function of the testicles. Sometimes testicular pain can be linked to sexual behavior, hormonal imbalances, or even post-ejaculatory symptoms. Common causes. 1. Post-ejaculatory pain. Some men experience aching in the testicles after ejaculation. This may result from congestion in the epididymis or prostate. While usually harmless, frequent pain should be evaluated. 2. STIs and infections. Sexually transmitted infections are a major cause of testicular discomfort in young men. Chlamydia, gonorrhea, and trichomoniasis can all lead to painful inflammation of the epididymis or testicle. 3. Prostatitis. Inflammation of the prostate can refer pain to the testicles and is often mistaken for a direct testicular problem. Symptoms may include pain during ejaculation or urination, pelvic discomfort, and frequent urination. 4. Blue balls epididymal hypertension. A temporary harmless condition resulting from prolonged sexual arousal without ejaculation, leading to a dull ache. It typically resolves on its own and doesn't require treatment. Prevention and care. Use condoms and practice safe sex. Maintain good hygiene. Communicate openly with partners about symptoms. Seek medical care for any unusual discharge, swelling, or persistent pain. Section 18. Testicular pain and mental health. Testicular pain can cause more than just physical discomfort. The mental and emotional toll can be significant, especially when pain is chronic, unexplained, or impacts sexual performance or fertility. Psychological effects. Anxiety and fear. Constant worry about cancer or serious illness. Depression. Pain that limits daily function can lead to sadness, withdrawal, and hopelessness. Relationship stress. And concerns over fertility or intimacy may strain personal relationships. Body image issues. Men who undergo surgery or lose a testicle may struggle with confidence or self-esteem. Mental health support. Therapy or counseling can help men cope with emotional burdens. Support groups for men's health or cancer survivors provide shared understanding. Open communication with doctors can ease fears and improve outcomes. There's no shame in seeking mental health care for pain-related distress. Pain is both physical and emotional, and both aspects deserve attention. Section 19. Surgical treatments for testicular conditions. Surgical intervention is sometimes necessary for testicular conditions. Understanding the types of surgeries and their outcomes helps reduce fear and encourage timely treatment. Common procedures. 1. Orchiectomy. Surgical removal of one or both testicles, typically for cancer treatment or severe trauma. Men can still lead normal lives with one testicle, and prosthetics can be implanted for cosmetic purposes. 2. Orchiopexy, used in cases of testicular torsion. The testicle is untwisted and stitched to the scrotal wall to prevent future torsion. It may also be performed on the unaffected side as a preventive measure. 3. Hernia repair, herniorrhaphy. So inguinal hernias may be repaired through open or laparoscopic surgery. Mesh may be used to strengthen the abdominal wall and prevent recurrence. 4. Varicocelectomy. Surgical correction of varicocele by ligating the dilated veins. This may relieve pain and improve fertility. 5. Spermatocelectomy or hydrocelectomy. Removal of large cysts or fluid-filled sacs that cause discomfort or pressure. 6. Microsurgical denervation of the spermatic cord. For chronic scrotal pain that doesn't respond to other treatments, this procedure cuts pain-transmitting nerves in the spermatic cord. Recovery and outlook. Most testicular surgeries are safe and effective. Recovery time varies, but scrotal support, pain management, and light activity are standard during healing. Surgical outcomes are often positive when procedures are done early and with proper follow-up. Section 20. The role of hormones in testicular health. Hormones, particularly testosterone, play a crucial role in testicular function. Any imbalance may cause symptoms, including pain. Hormonal-related causes of pain, low testosterone, hypogonadism, may lead to testicular shrinkage, discomfort, and reduced libido. Testicular atrophy, decreased testicular size due to hormonal imbalance, infection, or aging, may cause mild pain or a feeling of tightness. Endocrine tumors, rare but hormone-secreting tumors can affect testicular function and cause discomfort. Diagnosis and treatment. Blood tests for testosterone, LH, FSH, and other hormones can identify imbalances. Hormone replacement therapy, HRT, may be used, though under strict medical supervision. Treating underlying conditions usually resolves hormonal symptoms. Section 21. Frequently asked questions. FAQ. Is testicular pain always an emergency? A. Not always, but sudden severe pain could be a sign of torsion and requires emergency attention. Persistent or unexplained pain should also be evaluated. Q. Can masturbation or sexual activity cause testicular pain? Occasionally, particularly if there's prolonged arousal without ejaculation, but frequent pain during or after sex could indicate a medical issue. Does testicular pain always mean cancer? No. Most testicular pain is caused by infections, trauma, or structural issues. Cancer is often painless in early stages. Q. Can tight underwear cause testicular pain? A. Yes. Tight-fitting underwear can restrict blood flow and cause discomfort, especially during physical activity. What is the best way to check for testicular cancer? A. Monthly self-exams in a warm shower are effective. Feel for any hard lumps, swelling, or changes in size or consistency. Section 22. Global awareness and testicular health campaigns. Awareness about testicular health is growing, thanks to global initiatives and educational campaigns. Movements like Movember have encouraged millions of men to take their health seriously. Movember campaign focuses on men's health, including testicular cancer, prostate cancer, and mental health. Encourages men to grow mustaches during November as a symbol of awareness. Promotes early screening, open discussions, and self-examinations. Other awareness initiatives. Schools incorporating male reproductive health into curriculum. Healthcare providers offering free screenings. Online resources and mobile apps that teach self-exams and track symptoms. Participation in these campaigns helps break stigma and save lives through early detection. Section 23. Future innovations in testicular pain diagnosis and treatment. Medical science continues to evolve. New technologies and approaches are improving the diagnosis and management of testicular pain. Emerging tools. High-resolution ultrasound. Improved imaging helps detect subtle conditions earlier. Wearable devices. Future devices may track scrotal temperature, pressure, and pain levels to identify warning signs. Non-surgical interventions. Techniques like nerve stimulation and regenerative therapies are being studied for chronic pain. Artificial testicles and prosthetics. More lifelike and functionally adaptive prosthetics are becoming available for men undergoing orchiectomy. Telemedicine enables discreet consultations and remote assessments for those hesitant to seek in-person care. Innovation promises greater comfort, better outcomes, and less stigma around men's health concerns. Section 24. Final thoughts. Taking ownership of your health. Testicular pain is a signal, a message from your body that should never be ignored. Whether it's the result of a minor issue or a serious condition, understanding your symptoms and acting quickly is vital. Your health is your responsibility. Taking action means being aware of your body, speaking up when something doesn't feel right, encouraging friends, brothers, and sons to do the same. There's no shame in pain. There's only power in knowledge, courage in asking for help, and strength in seeking treatment. Protect your future by caring for your health today. Section 25. Testicular pain in different cultural and social contexts. Testicular health is not just a medical issue. It's deeply influenced by culture, tradition, and social beliefs. In many parts of the world, topics related to male reproductive health are considered taboo, leading to silence, delayed diagnosis, and avoidable suffering. Cultural barriers. 1. Stigma and shame. In conservative societies, men may feel embarrassed or ashamed to discuss testicular pain, even with doctors. This leads to denial, self-treatment, or ignoring serious symptoms. 2. Lack of education. Many young men are never taught about self-examination, testicular cancer, or the warning signs of infections and torsion. As a result, they may not recognize danger signs when they appear. 3. Traditional remedies. In some cultures, men may rely on herbal or folk remedies instead of medical advice, potentially worsening infections or delaying needed surgery. Breaking the silence. Schools and religious organizations can play a vital role in promoting testicular health education. Health campaigns should be translated into local languages and respect cultural sensitivities. Male health advocates and influencers can normalize conversations around testicular health. Awareness must be global, but more importantly, it must be inclusive, respectful, and culturally informed. Section 26. Testicular pain and the role of caregivers and partners. Pain doesn't happen in isolation. For many men, especially those who are married or in relationships, testicular pain becomes a shared concern. Partners and family members often notice changes in mood, behavior, or physical activity. Ways partners and caregivers can help. 1. Observation. Noticing if he's walking differently, avoiding physical contact, or complaining of discomfort. 2. Encouragement. Supporting him in scheduling a doctor's visit, especially if he's hesitant or embarrassed. 3. Emotional support. Listening without judgment, showing empathy, and reinforcing that seeking help is a sign of strength, not weakness. 4. Assisting in recovery. Helping with transportation, medication, or post-surgical care during recovery periods. A strong support system can make the difference between delayed suffering and prompt recovery. Section 27. Pediatric testicular pain, special attention for boys. Testicular pain in boys is often overlooked or misunderstood. Children might not have the words to express what they feel, and parents might assume the issue is temporary or unrelated. Common pediatric causes. Testicular torsion. Most common between ages 10 to 18, though it can happen at any age, even in infants. Torsion of the testicular appendage. A small, non-functional remnant structure near the testicle can twist and cause localized pain. Inguinal hernias. Often present at birth or develop in early childhood. Trauma from play or sports. Infections like mumps or epididymitis in older boys. Warning signs in children. Sudden crying or irritability without clear cause. Refusing to walk or sit. Swollen, red, or firm scrotum. Nausea or vomiting. What parents should do. Never ignore testicular pain or swelling in boys. Seek emergency care if symptoms are sudden or severe. Encourage boys to speak openly about discomfort without shame. Early diagnosis and treatment can prevent long-term consequences like infertility or organ loss. Section 28. Testicular pain and work-life balance. Chronic or intermittent testicular pain can interfere with daily routines, especially work and physical activity. Many men continue to work through pain, pushing their limits while ignoring symptoms. Effects on work and activity. Inability to sit or stand for long periods. Difficulty lifting or bending. Reduced productivity due to constant discomfort. Fear or anxiety that pain might worsen during the day. Workplace support strategies. Seeking ergonomic adjustments like better seating. Taking frequent breaks to reduce pressure on the groin. Using supportive undergarments. Informing supervisors when time off is medically necessary. Employers and coworkers should support men dealing with health challenges without stigma or shame. Section 29. Natural and home remedies for mild testicular discomfort. For mild cases where medical causes have been ruled out, certain home remedies can provide relief. These are supportive, not substitutes for proper diagnosis. Common approaches. 1. Cold compresses. Applying a wrapped ice pack for 15 to 20 minutes several times a day helps reduce inflammation and swelling. 2. Scrotal elevation. Supporting the scrotum while lying down can relieve pressure and pain. 3. Warm baths. Gentle heat can relax muscles and ease dull aches or post-infectious discomfort. 4. Over-the-counter medications. NSAIDs like ibuprofen or acetaminophen reduce pain and inflammation. 5. Avoid tight clothing. Loose-fitting underwear allows for better airflow and reduced irritation. 6. Hydration and anti-inflammatory diets. Staying hydrated and reducing processed foods can help decrease systemic inflammation. Caution: if symptoms worsen, persist beyond a few days, or are accompanied by fever, swelling, or changes in testicular shape, seek medical attention immediately. Section 30. Testicular cancer, a silent but treatable threat. Although rare, testicular cancer is one of the most serious causes of testicular pain or change, and one of the most curable when caught early. Who's at risk? Men between the ages of 15 and 35. Family history of testicular cancer. Undescended testicles, cryptorchidism. Previous testicular cancer. Warning signs: painless lump or swelling in one testicle, feeling of heaviness in the scrotum, dull ache in the lower abdomen or groin, sudden fluid buildup in the scrotum. Diagnosis: physical exam, scrotal ultrasound, tumor marker blood tests, AFP, HCG, LDH, CT scans to check for spread. Treatment: surgical removal or orchiectomy, chemotherapy or radiation in advanced stages, regular follow-up with scans and blood work. Survival rate: over 95% in early detected cases. Awareness and self-examination are key to survival. Section 31. Role of diet and lifestyle in testicular health. Healthy testicles are supported by a healthy lifestyle. Diet, exercise, and habits play an essential role in hormone balance, blood flow, and immune defense. Foods that support testicular health. Zinc-rich foods: oysters, pumpkin seeds, lentils. Healthy fats: avocados, nuts, olive oil. Antioxidants: berries, spinach, green tea, selenium, Brazil nuts, eggs. Vitamin D and magnesium. Sunlight, leafy greens, fish. Habits to avoid: smoking, linked to reduced sperm count and increased cancer risk. Excessive alcohol use, anabolic steroid use. Prolonged heat exposure, e.g. hot tubs or tight pants. Chronic stress and poor sleep. Consistent health habits promote reproductive longevity and reduce the risk of complications. Long-term management of chronic testicular pain. Some men suffer from long-term testicular pain without a clearly identifiable cause. This condition is known as chronic orchialgia and may persist for months or even years. Possible causes: nerve entrapment, past surgeries or trauma, muscle tension and referred pelvic pain, psychogenic factors, stress, anxiety. Treatment options: pain management, NSAIDs, nerve blocks, physical therapy, pelvic floor release, posture correction, counseling and mental health support. Surgical denervation, Botox injections for muscle-related causes. It's important to work with a multidisciplinary team, including urologists, pain specialists, and therapists to find lasting relief. Section 33. The importance of follow-up and monitoring. After any episode of testicular pain, proper follow-up is critical to prevent recurrence or catch complications early. What follow-up may include: repeat imaging, ultrasound, monitoring tumor markers for cancer, semen analysis for fertility issues, infection clearance, repeat urine STI tests, physical exams at 3, 6, or 12-month intervals. Consistency in care prevents relapse and builds confidence in long-term recovery. Section 34, Building a Health-Conscious Mindset. Testicular health should be part of a broader lifestyle of health awareness. Men should be taught from a young age that caring for their body isn't weakness, it's wisdom. Habits to build. Monthly self-exams. Routine medical checkups. Open conversations with partners and doctors. Early response to symptoms. Educating younger generations. Just as women are encouraged to monitor breast health, men should feel equally empowered to monitor testicular health without shame or secrecy. Conclusion: from awareness to action. Testicular pain is not a topic we hear about often, but it's one every man should understand, whether it's caused by an injury, infection, torsion, or something more serious like cancer. Pain is never something to ignore. Early awareness can save fertility. Early detection can save lives. And timely action can prevent a lifetime of regret. So take the first step. Learn, observe, speak, and never be afraid to protect what matters. Because when it comes to your health, silence is not strength. Action is. Section 35, Male Fertility and Testicular Health. The testicles play a critical role in male fertility. Any disruption in their function can impact sperm quality, hormone levels, and overall reproductive health. Men dealing with testicular pain may also worry about their ability to conceive, especially if the issue is prolonged or recurrent. How testicular conditions affect fertility. 1. Infections, e.g. epididymitis or chitis. Inflammation from infections can scar the reproductive tract, blocking sperm flow or damaging sperm cells. 2. Varicocele. This condition is a leading cause of male infertility. The pooling of blood raises testicular temperature, which impairs sperm production and function. 3. Testicular torsion. Torsion that isn't treated promptly can lead to testicular atrophy or removal, cutting sperm production by half. 4. Trauma. Physical injuries can damage tissue and disrupt the sperm-making process. 5. Undescended testicle, cryptorchidism. If not corrected early, the testicle may not develop properly, reducing sperm output. Testing and diagnosis. Semen analysis. Evaluates sperm count, motility, and shape. Hormone testing measures testosterone, LH, FSH, and prolactin. Scrotal ultrasound identifies structural issues like varicocele or cysts. Genetic testing in cases of unexplained infertility. Fertility preservation. Sperm banking recommended before surgery or treatment for cancer. Hormone therapy can stimulate sperm production if hormone levels are low. Assisted reproductive techniques, ART, including IVF, IC, or intrauterine insemination. Fertility concerns should always be part of the conversation when evaluating testicular pain, especially in younger men or those planning a family. Section 36, Testicular Prosthetics and Cosmetic Concerns. After the removal of a testicle, either due to cancer, torsion, or trauma, men may feel a loss of identity, body image issues, or embarrassment in relationships. Fortunately, testicular prosthetics offer a solution. What is a testicular prosthesis? It is a silicone implant placed in the scrotum to simulate the appearance and feel of a natural testicle. Benefits: restores symmetry and appearance, boosts confidence and self-image, no impact on sexual function or fertility if the other testicle remains intact. Procedure and recovery: typically performed under general anesthesia, minimal scarring and downtime, low risk of complications. Considerations: some men may choose not to get an implant and still lead fully healthy lives. Others may delay the decision until emotionally ready. The choice is deeply personal and should be guided by a urologist and mental health support if needed. Section 37, Testicular Pain and Sexual Performance. Many men experiencing testicular pain also notice changes in sexual function. This may be physical, psychological, or both. Common complaints: erectile dysfunction due to pain or anxiety, premature ejaculation, decreased libido, pain during or after ejaculation, difficulty achieving orgasm. Contributing factors: inflammation or infection in the epididymis or prostate, anxiety about underlying health issues, fear of aggravating the condition during intercourse. Hormonal imbalance. Management: treat the underlying cause of pain. Address performance anxiety through counseling or therapy. Use pain management strategies to make intimacy more comfortable. Explore medication or devices for erectile issues if necessary. Open dialogue with partners, doctors, and therapists can help reduce anxiety and improve outcomes. Section 38. Testicular health across a man's lifespan. Testicular health evolves with age, and each phase of life brings its own set of risks and responsibilities. Infancy. Screen for undescended testicles. Monitor swelling or discoloration. Childhood. Be alert to injuries or hernias. Educate about body awareness and hygiene. Teenage years. Educate about testicular torsion and self-examination. Monitor for signs of varicocele or hormonal issues. Young adults, 20s, 30s, highest risk for testicular cancer. Practice safe sex to prevent infections. Maintain fertility awareness. Middle age, 40s to 50s, risk of chronic testicular discomfort. Watch for hernias, prostatitis, or lifestyle-related issues. Older age, 60 plus, monitor for scrotal masses or lower urinary tract symptoms. Recognize that testicular cancer, though rare, can still occur. Health checks should continue throughout life, not just when symptoms appear. Section 39. Men's health and the need for routine checkups. One of the biggest obstacles to managing testicular pain is the lack of routine checkups. Many men only visit a doctor when symptoms become unbearable. Why preventive visits matter. Catch problems early before they worsen. Track changes in testicular size, shape, or texture. Get screened for STIs, hormone imbalances, and cancer. Address concerns about fertility, libido, or sexual health. What a checkup includes: physical exam, including testicular palpation, urine and blood tests, ultrasound if abnormalities are suspected, health education. Make testicular health a routine part of your wellness strategy, just like checking blood pressure or cholesterol. Section 40. Public health initiatives to promote testicular awareness. Public health plays a vital role in reducing stigma and increasing knowledge about testicular pain and diseases. Effective campaign models. 1. Movember. Encourages men to grow mustaches during November to spark conversations about men's health, including testicular and prostate cancer. 2. Check Your Balls campaigns. Launched globally, often by cancer charities and hospitals to promote self-exams and early detection. 3. Mobile health clinics, bringing services to underserved or rural areas, especially where healthcare access is limited. 4. Social media challenges and awareness days, increasing participation by using hashtags, testimonials, and digital outreach. How you can help? Share educational resources. Talk openly with male friends and family. Support men's health foundations. Encourage boys and young men to learn early. Awareness leads to action, and action saves lives. Section 41. Advances in imaging and diagnostic tools. Medical imaging has revolutionized the way testicular issues are diagnosed and monitored. Latest technologies. Color Doppler ultrasound. Measures blood flow, helping detect torsion or tumors with high accuracy. Elastography. A specialized form of ultrasound that evaluates tissue stiffness, helpful in identifying tumors. MRI scrotum offers detailed imaging when ultrasound is inconclusive. 3D ultrasound gives better views of internal scrotal structures. These tools ensure that men receive accurate diagnoses quickly, minimizing risks and maximizing treatment success. Section 42. Managing pain without narcotics. Given the global opioid crisis, many patients and doctors seek alternative ways to manage testicular pain without strong narcotics. Non-narcotic pain management options, NSAIDs, e.g. ibuprofen, naproxen, effective for inflammation and mild to moderate pain. Topical analgesics, creams or patches applied directly to the area. Nerve blocks, local injections that numb the spermatic cord temporarily. Acupuncture may relieve chronic pain for some patients. Cognitive behavioral therapy, CBT, helps manage pain perception and reduce anxiety. Biofeedback and relaxation techniques reduce muscle tension and referred pain. A multidisciplinary pain management approach often yields better outcomes than narcotics alone. Section 43. Empowering the next generation. Boys and young men are rarely taught about testicular health, leaving them vulnerable to myths, fears, and delayed diagnoses. Early education is key. What boys should learn: basic anatomy and function of the testicles, how to perform a self-exam, when and why to see a doctor, that pain or lumps are not normal and never something to hide, that asking for help is a strength, not a weakness. Schools, parents, and media can help normalize these conversations and promote lifelong health habits. Section 44, creating a personalized testicular health plan. Every man is different, and a one-size-fits-all approach doesn't work. A personalized plan can help monitor, protect, and optimize testicular health. Steps to build your plan. 1. Know your risk factors. Family history, past injuries, lifestyle, sexual activity. 2. Schedule annual checkups. Make time for full body and testicular exams. 3. Track symptoms. Keep a journal of any pain, swelling, or discomfort. 4. Commit to monthly self-exams. Pick a day and stick to it. After a shower is ideal. 5. Stay informed. Keep up with the latest research, awareness campaigns, and prevention strategies. 6. Take action promptly. Never wait to see if pain goes away on its own. Taking ownership of your testicular health is one of the most important investments you can make for yourself and for your future. Conclusion of Part 5. We've now explored nearly every angle of testicular pain, its causes, symptoms, complications, and treatments. You've learned how to recognize danger signs, how to talk about pain, how to seek care, and how to take charge of your health. Next, in Part 6, we'll continue to focus on advanced treatment techniques, global statistics, inspiring recovery stories, and the future of male reproductive health. Section 45, advanced treatment options for complex testicular conditions. When first-line treatments like antibiotics, rest, or minor surgery fail to resolve testicular pain, or when conditions are more severe, advanced medical interventions may be necessary. 1. Microsurgical denervation of the spermatic cord, MDSC. IST, used for chronic orchialgia, long-standing testicular pain. This surgery involves cutting the small nerves responsible for transmitting pain signals from the testicle. It's done under a microscope to preserve vital structures. Benefits: high success rates for pain relief, preserves the testicle and fertility, minimally invasive with low risk of complications. Not 2. Varicocele embolization. An alternative to surgical ligation, this procedure involves inserting a small coil or agent into a vein to block the varicocele. It's performed by interventional radiologists under local anesthesia. 3. Laparoscopic surgery. Used for hernias or undescended testicles, laparoscopic procedures involve small incisions and a camera for minimal scarring and quicker recovery. 4. Robotic-assisted surgeries. Emerging technology allows for ultra-precise, minimally invasive testicular or urologic procedures. It reduces blood loss, scarring, and hospital stay duration. 5. Hormonal therapies. For conditions like testicular atrophy or hypogonadism, testosterone replacement therapy may restore normal function, energy levels, and mood, although fertility may decrease during treatment. Advanced treatments give hope to patients who've struggled with unresolved pain or complex conditions. Section 46. Understanding pain perception, the brain-testicle connection. Pain isn't just physical, it's also processed and amplified by the brain. Chronic testicular pain, even after the original cause has healed, can continue due to nerve memory or psychological reinforcement. Neurobiological factors. Central sensitization. The nervous system becomes hypersensitive, making normal sensations feel painful. Neuropathic pain. Damaged nerves may misfire, causing pain without a physical problem. Psychological triggers. Stress, anxiety, or depression can increase pain perception and make it more difficult to cope. Management approaches. Cognitive behavioral therapy, CBT, teaches patients to reframe pain responses and manage mental triggers. Biofeedback helps patients consciously control physiological responses to pain. Nerve modulation devices, like TENS, transcutaneous electrical nerve stimulation, which block pain signals. Understanding that pain is multifactorial empowers patients to seek both physical and mental health support. Section 47. Global testicular health statistics and trends. Understanding global data helps contextualize the significance of testicular health across populations. Key statistics. Testicular cancer incidence, most common in males aged 15 to 35. 1 in 250 men will develop testicular cancer in their lifetime. Highest rates observed in Europe and North America. Testicular torsion. Occurs in 1 out of every 4,000 males under 25 annually. Peak occurrence during adolescence. Infertility factors. Male factors contribute to 50% of infertility cases. Varicocele is found in 40% of infertile men. Delayed diagnosis. Average delay in seeking care for testicular pain is 3 to 7 days. Delays longer than 6 hours in torsion cases lead to a 50% loss rate. The takeaway: early awareness, access to healthcare, and cultural openness are critical to reducing these numbers. Section 48. Personal stories of recovery and resilience. Real-life experiences can inspire others to seek help and understand they are not alone. Story 1. Ahmed, 21, Pakistan, testicular torsion survivor. I thought it was just muscle strain after playing cricket, but by the next morning, I couldn't stand up. I went to the hospital and they rushed me into surgery. I lost 1 testicle, but I'm alive, healthy, and more aware now. Story 2. Luis, 34, Mexico. After a bike accident, the dull ache in my groin never went away. I tried medications, therapy, even acupuncture. Eventually, a urologist performed microsurgical denervation. Now, I'm almost pain-free and back to cycling. Story 3. Brandon, 27, USA, cancer survivor. Finding a lump changed my life. The cancer was caught early. I had surgery and chemo. Today, I educate others, because silence nearly killed me. Each story is proof that testicular pain is not the end. It's a call to action. Section 49. Common mistakes men make with testicular pain. Awareness isn't enough unless it's followed by proper action. Here are some of the most common mistakes that can delay diagnosis and worsen outcomes. 1. Ignoring the pain. Hoping it'll go away can be dangerous, especially with torsion or cancer. 2. Self-diagnosing with the internet. Online information helps, but is not a substitute for a medical professional. 3. Delaying medical attention. Out of embarrassment. Shame kills. Seeking care early saves. 4. Using over-the-counter creams or antibiotics without diagnosis. Misusing medications can hide symptoms or worsen infections. 5. Stopping treatment too early. Infections may return if antibiotics aren't taken completely. 6. Not following up after surgery or treatment. Skipping follow-ups can miss relapse signs or new complications. Avoiding these mistakes is vital to protecting reproductive health. Section 50. Innovation in male reproductive research. The world of testicular health is advancing thanks to breakthrough research. New technologies, drugs, and techniques are changing the way doctors diagnose and treat conditions. Ongoing research areas. Gene therapy, exploring ways to treat infertility at the DNA level. Artificial testicular tissue. Scientists are developing lab-grown tissue to produce sperm in men with damaged testicles. Smart underwear. Wearables that track testicular temperature and pressure to detect varicocele or overheating. Nanotreatments. Using nanoparticles to deliver medication directly to infected or inflamed testicular tissues. AI diagnostic tools. Algorithms trained to detect cancer or varicocele via ultrasound scans with high accuracy. These innovations are paving the way for earlier detection, personalized treatments, and greater hope for men worldwide. Section 51. Reproductive rights and men's health policies. Testicular health is deeply connected to reproductive rights and healthcare access. While much of reproductive advocacy focuses on women, rightfully so, men must also be part of the health equity conversation. What needs to change? Mandatory health education in schools. Men's health clinics with confidential services. Insurance coverage for fertility and pain treatments. Better access in rural and low-income areas. Employer support for medical leave due to men's health. Policy reforms should include free or subsidized screening programs, awareness campaigns funded by health ministries, mental health integration in urological care, mobile clinics reaching underserved populations. Testicular health matters for individuals, families, and communities. Section 52. The role of technology in patient education. Modern technology is transforming how men learn about and manage their health. Top digital tools, self-exam apps, reminders, guides, and virtual instructions for monthly checks. Confidential consultations with urologists from home. Wearables, smart bands tracking activity and alerting about sedentary risks. AI chatbots, providing symptom assessments and helping users decide when to see a doctor. Benefits: reduces embarrassment, encourages regular habits, makes health information accessible, bridges gaps in care for remote areas. Tech, when used right, becomes a partner in testicular health. Section 53, empowering boys through education and confidence. True change starts with the next generation. Teaching boys to understand and respect their bodies builds a culture of proactive health. Effective education methods. School programs led by male educators or healthcare workers. Peer mentorship and youth clubs focused on men's health. Parent-child conversations that normalize these topics. Animated videos, comics, and gamified health lessons. Messages boys should hear. Pain is not weakness, it's a message. Your body deserves care, not shame. Real strength means asking for help when you need it. Confidence comes from clarity, support, and knowledge. Section 54, the Testicular Health Checklist. To conclude this segment, here's a powerful, practical checklist every man should know and follow. Monthly self-exam. Know what normal feels like. Seek care for pain lasting more than 48 hours. Act immediately for sudden, severe pain. Use protection during sexual activity. Stay up to date with vaccines, e.g. mumps. Get regular checkups if over 15 or sexually active. Talk to a doctor about fertility concerns. Know your family history. Educate others in your circle. This list is your compass to long-term testicular health. Closing thoughts. Be the voice, not the statistic. Testicular pain is not rare. Neither is testicular cancer, infertility, or anxiety tied to men's health. What's rare is action. What's rare is courage. What's rare is breaking the silence before it breaks you. You have the power to reverse that trend. Talk about your symptoms. Teach your son what to look for. Ask your friend if he's done a self-check. Visit your doctor and take charge of your future. Testicular pain may start as a symptom, but it ends as a story of awareness, resilience, and transformation when you act. Section 55, a recap of core causes of testicular pain. Let's briefly summarize the key causes that can lead to testicular discomfort or serious illness. Understanding these causes gives context to everything we've explored. 1. Traumatic injury. A direct blow or sustained pressure to the scrotum, common in contact sports or accidents, can cause bruising, hematoma, or even rupture of the testicle. 2. Testicular torsion. A medical emergency where the spermatic cord twists, cutting off blood flow. It causes sudden, severe pain and requires surgery within 6 hours to save the testicle. 3. Epididymitis. Inflammation of the epididymis, typically caused by bacterial infections or STIs. Symptoms include swelling, pain, and sometimes fever. 4. Orchitis. Inflammation of the testicle, often caused by mumps virus or secondary to epididymitis. Stashta 5. Varicocele. Enlarged veins in the scrotum that can cause a dull ache and affect fertility. 6. Hydrocele. A fluid-filled sac causing swelling and discomfort, especially when large. 7. Spermatocele. A benign cyst in the epididymis that may cause pressure but is typically painless. 8. Hernia. Inguinal hernias can descend into the scrotum, causing pressure, dragging sensation, and visible bulging. Sign 9. Referred pain. Pain that originates from nearby areas such as the kidneys, bladder, or spine, but is felt in the testicles. 10. Testicular cancer. Often painless in early stages, but can cause swelling, heaviness, or dull ache. Section 56. The emotional toll of testicular pain. Beyond the physical symptoms, testicular pain can weigh heavily on a man's mental health. The discomfort is often accompanied by anxiety, embarrassment, and fear of serious diagnoses like cancer or infertility. Common emotional reactions: fear of a life-changing diagnosis, shame in discussing reproductive health, social withdrawal or decreased intimacy, worry about masculinity or sexual performance. How to cope: speak openly with trusted people. Join online or in-person support groups. Seek therapy if pain leads to depression or anxiety. Remember, pain is a signal, not a sentence. Healing isn't just about the body. It's also about restoring peace of mind. Section 57. Reproductive Anatomy Review. Know your body. Understanding the male reproductive system helps demystify testicular pain. When men know how their anatomy works, they're better equipped to notice when something feels wrong. Key structures: Testicles produce sperm and testosterone. Epididymis, sperm matures here. Vas deferens transports sperm to the urethra. Spermatic cord contains blood vessels, nerves, and vas deferens. Scrotum holds and regulates the temperature of the testicles. Seminal vesicles, prostate gland, produce fluid that nourishes and protects sperm. Self-exam tip: gently roll each testicle between your thumb and fingers. Check for lumps, firmness, swelling, or changes in size. Section 58. The link between testicular health and hormones. Hormonal imbalances can lead to testicular pain and dysfunction. The testicles are hormone-sensitive organs, particularly to testosterone, LH, and FSH. Signs of hormonal issues: shrinking testicles, decreased libido, erectile dysfunction, mood swings, fatigue, or depression, infertility or low sperm count. Diagnosis: blood tests for hormone levels, physical exam for testicular size and consistency, semen analysis if fertility is a concern. Treatment: testosterone replacement therapy, TRT, clomiphene citrate or HCG therapy for younger men needing fertility preservation, lifestyle changes, exercise, better sleep, weight loss, quitting smoking. Restoring hormonal balance can alleviate pain and improve reproductive function. Section 59. Case studies in delayed diagnosis. These true-to-life cases illustrate the consequences of not addressing testicular pain in time. Case 1, torsion missed. Ali, 16, ignored sudden scrotal pain for 2 days, assuming it was sports-related. By the time he sought care, his testicle was non-viable and had to be removed. Case 2, silent cancer. Jake, 30, noticed a painless lump for 3 months, but didn't mention it out of embarrassment. It turned out to be stage 2 testicular cancer, requiring surgery and chemotherapy. Case 3, chronic infection. Ravi, 42, self-medicated for recurring groin pain for months before seeing a urologist. He had chronic epididymitis with scarring that impaired fertility. Lesson: early action prevents regret. Pain is the body's request for attention. Section 60. Men's health in low-resource settings. In many parts of the world, men lack access to urologists, reliable diagnostics, or educational resources about testicular health. Barriers: cost of care, distance to hospitals, cultural silence around male reproductive issues, lack of public health campaigns. Solutions: mobile health vans for rural areas, training general practitioners in basic urology. Digital platforms offering symptom checks and consultations. Distribution of multilingual educational pamphlets. Men everywhere deserve to be informed, empowered, and treated, regardless of income or geography. Section 61. The role of diet in reducing inflammation and pain. Nutrition plays an underrated role in testicular health. Anti-inflammatory diets can support hormonal function, reduce discomfort, and promote healing. Foods that help. Omega-3 fatty acids. Salmon, walnuts, chia seeds. Antioxidants. Blueberries, spinach, green tea. Zinc. Pumpkin seeds, chickpeas. Vitamin E and selenium. Almonds, Brazil nuts. Hydrating fruits. Watermelon, cucumber, oranges. Foods to avoid. Processed meats and fried foods. Excess sugar and refined carbs. Alcohol in large amounts. Soy-based products. Controversial, but moderation is key. Lifestyle plus diet equals better outcomes. Section 62. Sexual wellness and recovery after testicular procedures. Following surgeries like orchiectomy or denervation, many men worry about intimacy and sexual identity. But recovery, both physical and emotional, is possible. What to expect? Temporary sensitivity or pain. Possible changes in libido or erection strength. Psychological impact. Body image or masculinity concerns. Fertility may remain intact if one healthy testicle remains. Tips for a healthy sex life post-recovery. Communicate with your partner. Use counseling if sexual anxiety develops. Resume activity slowly and with guidance. Use medical aids if necessary. PDE5 inhibitors, lubricants, etc. Sexual health is part of your recovery, not separate from it. Section 63. Faith, spirituality, and healing. For many men, spiritual beliefs provide comfort during health struggles. Testicular pain can challenge identity and masculinity, but also open paths to deeper self-understanding. Ways spirituality can help. Reduces anxiety and fear through prayer or meditation. Encourages acceptance and emotional resilience. Provides a framework for meaning and support. Builds community through faith-based support groups. Spiritual care is valid and powerful. Integrating it into healing is a personal, empowering choice. Section 64, reintegration into daily life after testicular illness. Returning to work, exercise, and relationships after surgery or illness can be challenging. Men often fear re-injury, embarrassment, or permanent changes. Steps for reintegration. 1. Medical clearance. Always wait for doctor's go-ahead. 2. Gradual return to activity. Start light, increase over weeks. 3. Supportive gear. Use scrotal support garments during activity. 4. Mental readiness. Journaling, therapy, and positive reinforcement help. 5. Realistic expectations. Healing isn't linear. Be patient. Healing is not just about being pain-free, it's about living fully again. Section 65, final summary, everything you need to know. Common causes: torsion, infection, trauma, cancer, hernias. Symptoms: pain, swelling, heaviness, lumps, fever. Tests: ultrasound, urine test, semen analysis, hormone panels. Treatments: medications, surgery, counseling, hormone therapy. When to seek help: any sudden, severe, or persistent pain. Monthly self-exam, best prevention tool. Support systems: partners, doctors, mental health professionals. Future trends: AI diagnostics, gene therapy, remote care. You've now journeyed through the full spectrum of testicular pain, from causes to cure, from stigma to strength. Your health is your power. Don't wait for pain to become a crisis. Check, speak, act. Take charge of your health. Listen to your body, act early, and never ignore testicular pain. Your future could depend on it.